Hello, everyone. I'm Deborah Wilson, a geriatric physician. Over more than 20 years of caring for older adults, I've noticed something that happens again and again in my clinic. Many patients come to see me because their blood pressure is high or difficult to control, even though they are following their treatment plan very carefully. They take their medication regularly, limit salt, walk every day, and even monitor their blood pressure at home. And they ask me, I've done everything right. Why is my blood pressure still high? In many cases, the answer is not the heart, it's not the kidneys, it's not their diet. It's another medication, one they're taking every day without realizing it may be raising their blood pressure. In geriatrics, we follow a very important principle. Before adding a new medication, review the ones already being taken. Sometimes the solution is not increasing the dose, but removing a factor that is interfering. Today, I want to share one of the most important strategies for improving blood pressure in older adults: identifying and avoiding medications that may raise blood pressure. What's important to understand is this: many of these medications are available over the counter. Many people use them every day. Some are prescribed by different specialists, and most patients are never warned about their effect on blood pressure. If you are being treated for high blood pressure, or if you are caring for aging parents with hypertension, this information can make a significant difference. Why can medications raise blood pressure? Blood pressure is not just a single number. It's the result of several systems working together. The sympathetic nervous system, the hormonal system, especially the renin-angiotensin-aldosterone system, the kidneys, the elasticity of blood vessels, the amount of fluid in the body. Some medications can affect one or more of these systems. They may cause blood vessels to tighten, make the body retain salt and water, increase heart rate, alter hormone balance, reduce the effectiveness of blood pressure medications. When blood vessels tighten or the body holds on to more fluid, blood pressure rises. In younger people, the body can often compensate, but in older adults, several natural changes make them more sensitive to medication side effects. Blood vessels become stiffer. Kidney function declines. Blood pressure reflexes respond more slowly. Other medical conditions are often present. As a result, the same medication can have a much stronger effect in a 7-0-year-old than in a 3-0-year-old. In clinical practice, I often see that simply stopping one unnecessary medication can significantly improve blood pressure without increasing blood pressure drugs. 7 common types of medications that can raise blood pressure. Now I'll go through the groups of medications I see most often. 1, cold and decongestant medications. This is the most common and most overlooked group. Medications containing pseudoephedrine or phenylephrine are often found in cold and flu remedies, decongestants, some allergy medications, cold and flu combination products. These medications work by shrinking blood vessels in the nose to relieve congestion. But when they enter the bloodstream, they can tighten blood vessels throughout the body. When blood vessels tighten, blood pressure increases. In people who already have high blood pressure, just a few days of decongestant use can raise blood pressure by 10 to 20 points. I once had a 2-year-old patient whose blood pressure had been stable for years. After a cold, he took an over-the-counter cold medicine for 5 days. When he returned for follow-up, his blood pressure had risen to 180/95. The cause was not heart failure. It was simply the decongestant. Safer alternatives may include saline nasal rinses, saline nasal spray. Speaking with your doctor before using cold medications. 2, NSAID pain relievers. This group includes ibuprofen, naproxen, diclofenac. These are very common among older adults with joint pain. NSAIDs can cause the body to retain salt and water, reduce blood flow to the kidneys, decrease the effectiveness of blood pressure medications. Blood pressure may increase by 5 to 10 points, sometimes more in people with kidney disease. If you have chronic joint pain, talk with your doctor about safer alternatives such as acetaminophen at the proper dose, topical pain relievers, physical therapy, weight management. 3, corticosteroids. Medications like prednisone or dexamethasone are used for severe allergies, autoimmune conditions, and inflammatory diseases. Steroids can cause salt and water retention, increase blood volume, stimulate the nervous system. Even a few weeks of use can significantly raise blood pressure. 4, estrogen-containing medications. Certain birth control pills or hormone replacement therapies can activate hormonal systems that increase fluid retention and raise blood pressure. 5, some antidepressants, SNRI type. Medications such as venlafaxine or duloxetine can raise blood pressure because they increase norepinephrine levels. 6, supplements with stimulants. Some weight loss or energy products contain high amounts of caffeine or stimulant ingredients that increase heart rate and blood pressure. Many people do not realize supplements can affect blood pressure. 7, certain eye drops. Some medications used for glaucoma or redness may be absorbed into the bloodstream and affect blood pressure in sensitive individuals. Who should be especially careful? People who already have high blood pressure, people whose blood pressure fluctuates frequently, people with kidney or heart disease. If you are taking any of these medications, the most important thing, do not stop prescribed medications on your own. Instead, make a list of all medications you take. Bring the list to your doctor. Ask specifically about their effect on blood pressure. In many cases, we can reduce the dose, switch to a safer alternative, or monitor more closely. However, to truly understand why older adults are more sensitive to these effects and why blood pressure can rise even when someone is taking their prescribed blood pressure medications correctly, we need to look more closely at how the body regulates blood pressure and what happens inside the body when these medications are introduced. Because blood pressure is not just a number on a monitor. It is the result of a complex interaction between the nervous system, hormones, the heart, blood vessels, and the kidneys. To truly understand why a single pill can raise blood pressure and why this matters, especially in older adults, we need to look at 3 major regulatory systems. 1, the sympathetic nervous system, the body's accelerator. The sympathetic nervous system controls the fight or flight response. When activated, the heart beats faster. Blood vessels tighten by, blood pressure rises. Medications like pseudoephedrine, phenylephrine, some SNRIs, and even high doses of caffeine stimulate this system by increasing norepinephrine. In younger individuals, when blood pressure rises, the body adjusts through pressure sensors called baroreceptors located in the carotid arteries and aorta. These sensors signal the brain to slow the heart and relax blood vessels. But with aging, baroreceptors become less sensitive. Reflexes respond more slowly. Blood vessels lose elasticity. So when a medication stimulates the sympathetic system, the body does not correct the rise in blood pressure as efficiently. This is why a mild cold medicine may not affect a 30-year-old, but can significantly raise blood pressure in a 75-year-old. To the renin-angiotensin-aldosterone system, RAS, this hormonal system helps regulate blood pressure and blood volume. When activated, blood vessels tighten, the kidneys retain sodium, the body retains water, blood pressure rises, Some medications can activate or interfere with this system. For example, estrogen may increase RAS activity. Corticosteroids increase sodium retention. Some anti-inflammatory drugs reduce the effectiveness of RAAS blocking medications. In older adults, kidney function naturally declines over time. This makes it harder to eliminate excess sodium. When medications cause additional fluid retention, blood pressure rises more easily and may stay elevated longer. 3, the kidneys, the body's fluid regulators. The kidneys play a central role in controlling blood pressure by managing sodium and water balance. NSAIDs directly affect the kidneys by blocking prostaglandins. Prostaglandins help maintain healthy blood flow to the kidneys. When they are blocked, kidney blood vessels constricted. Filtration decreases. Salt and water are retained. Blood volume increases. Blood pressure rises. In people with underlying kidney disease, this can lead to resistant hypertension tach, acute kidney injury, swelling, elevated potassium levels. For this reason, geriatric physicians are especially cautious when prescribing NSAIDs to individuals over 65, particularly those already taking ACE inhibitors, ARBs, or diuretics. Drug interactions, what many people don't realize, some medications not only raise blood pressure directly, but also reduce the effectiveness of blood pressure medications. Example 1, NSAIDs plus ACE inhibitors plus diuretics. This combination is sometimes informally called a triple hit to the kidneys. Diuretics reduce blood volume. ACE inhibitors dilate certain kidney blood vessels. NSAIDs constrict kidney blood vessels. Together, these effects can sharply reduce kidney blood flow and lead to acute kidney injury. Blood pressure may fluctuate and become difficult to control. Example 2, corticosteroids plus diuretics. Steroids retain salt and water. Diuretics try to remove water. These opposing effects can cause blood pressure instability and electrolyte imbalance. Example 3, stimulants plus beta blockers. Beta blockers slow heart rate and reduce sympathetic activity. But if someone takes decongestants or stimulant products, the stimulant effect can override this control, and blood pressure may still rise. Signs that blood pressure may be rising due to medication. In clinical practice, I suspect medication-related blood pressure increases when blood pressure rises after starting a new medication. Previously stable blood pressure suddenly increases. There is unexplained swelling. There have been recent changes in treatment for pain, allergies, or colds. A simple but important question I often ask is, has anything new been added in the past few weeks? Many times the answer is yes. A key principle in geriatric medicine. We always try to remove contributing factors before adding more medication. Increasing blood pressure medication without identifying the cause can lead to excessively low blood pressure, dizziness, AFALs, kidney problems. Effective blood pressure control is not just about reaching a target number, it is about reaching it safely and sustainably. And sometimes the most important step is not adding something, but knowing what to take away.